Hello, good morning, good afternoon, and good evening. Welcome to our webinar today on Advanced Stroke Life Support. My name is Jennifer Crum, the Associate Marketing Manager for our International Department here at the American Heart Association. Today, you will hear from two very impressive speakers on Advanced Stroke Life Support. Your speakers today are Dr. Yvette Motella. She is the Associate Professor of Surgery, Division of Emergency Medicine Center, Assistant Director and Director of Division of Pre-Hospital and Emergency Training at the Gordon Center for Simulation and Innovation and Medical Education at the University of Miami Miller School of Medicine. And Marita Straccia, she is the International Resuscitation Programs Manager at the American Heart Association. Feel free to put your questions in the Q&A, and we will get to the questions and answers at the end of the hour session. We have disabled raising your hand, so feel free to put your questions in the Q&A. We appreciate all of you joining today. This session will be recorded, and you will receive a copy of the recording and the presentation by tomorrow. Marita, I will pass it off to you now.
Here I am. I just gotta get my camera going. There we go. Good morning, good afternoon, and good evening to everyone, depending on where you all are in the world. We are all excited to see so many from many locations across the globe. We thought it would be a good idea to introduce the ACLS course and this exciting new program that we are launching globally by providing an overview video. So let's watch that and then we will begin.
Stroke is the leading cause of long-term disability and a leading cause of death throughout the world. Advances in the last few decades have dramatically changed outcomes in stroke. Timely, appropriate, and efficient evaluation and management of stroke patients reduces morbidity and mortality. The new Advanced Stroke Life Support, or ASLS Blended Learning Course, aims to educate both pre-hospital and in-hospital healthcare providers to optimize the identification, evaluation, and management of patients with stroke. The ASLS Blended Learning Course was co-developed by the American Heart Association and the University of Miami's Gordon Center for Simulation and Innovation in Medical Education, and is based upon the best available medical evidence and practices. Designed in a blended learning format, the courses consist of both online and in-person skills testing portions. In the online component, learners follow a continuously adapting learning path that is personalized by their own inputs for not only their performance, but also their self-reported confidence level related to each probe. In-person skills tests will challenge learners to apply the skills and knowledge obtained from the online portion to correctly perform neurologic exams, diagnose and manage patients with stroke. Offering education on the most common stroke screening tools, skills tests can be tailored to fit the tools used in local protocols. Within each section, students will learn skills via videos, animations, knowledge checks, and interactive activities to promote learning. All students must successfully answer each probe and pass each cognitive assessment activity to successfully complete the online course. Students will also have access to their respective provider manuals and a digital reference guide within the online course. After they complete each activity, students will receive a certificate of completion. This certificate is required before they can take the hands-on portion of the course. Once they receive their certificate, students can then attend a structured, instructor-led hands-on session that focuses on skills testing, during which instructors simulate stroke syndromes. After passing their skills test, students will receive a course completion card valid for 2 years. The Advanced Stroke Life Support Blended Learning Course not only satisfies requirements for stroke center certification education, but can help providers take the care of patients with stroke to the next level. Join us to help save lives.
Thank you so much, Marida. So we wanted to start with just a little bit of background about the course, and I did want to take another opportunity to thank everyone for joining us and welcome you to today's webinar. We're going to go into more detail in what you just watched, details about how the course works, and then we'll also talk about the process to become a training center instructor, et cetera. We'll go into lots of details about that and hopefully answer any questions you have. So the Advanced Stroke Life Support curriculum began all the way back in 1998, shortly after the NINDS trial came out, showing that alteplase was effective for ischemic stroke. There was a really just large need for educating everyone around identifying stroke and getting patients to the hospital. And I think, as everyone knows, it's been, quite a journey globally to get us, to this point, but that need still exists. And so that's how we got started. The course was originally developed, focused on both EMS, so pre-hospital care, as well as hospital-based care. And it was created and updated by a consortium of stroke neurologists, emergency physicians, nurses, and paramedics. And the goal then, as it is now, is really to equip healthcare professionals with the knowledge and skills to be able to efficiently and effectively care for patients with stroke. The partnership with the American Heart Association began at the end of 2019, shortly before the pandemic, which I'll talk a little bit about, led us down the blended learning path. And it really allows an opportunity to expand stroke education globally. It's what we're trying to do, really get this to as many healthcare professionals as possible, so that everyone is on the same page when it comes to how to effectively take care of stroke patients. And because we only had an instructor-led course infrastructure, it really limited the ability for really busy clinicians to be able to participate in the training. And so that's one of the things that we try to do with the blended learning format. If I could have the next slide, Ryan. Thank you. So the blended course, as we talked about, is adapted from the ASLS instructor-led course, but the content has been updated, significantly expanded, as we'll show you a little bit more of, reviewed by subject matter experts, a broad array of subject matter experts in stroke and education. And if you're familiar with the hard code courses that have the online e-learning plus in-person skills evaluation, the ASLS course follows that model. And again, we're going to get a lot more into a lot more detail about that. Next slide.
Okay, so a little bit about ASLS and stroke guidelines. The ASLS course is aligned with our stroke guidelines from 2018, 2019, and it includes ischemic stroke, TIA, and intracerebral hemorrhage as well. And we are updating the course for the new guidelines that were released for SAH in 2023. This course was designed with our subject matter experts and their phenomenal team with an immense amount of knowledge led by the Gordon Center. Next slide. Our intended audience for this course is any provider that would interact with patients that are at risk for stroke. So essentially, it could be anyone from outpatient surgery to emergency or even your neuro skills units, paramedics, pre-hospital, anyone that interacts with patients that are at risk for stroke. The minimum provider requirements is that they be proficient in BLS skills. For instructor status, the preferred minimum instructor requirements are ACLS instructor or a current ASLS instructor. Next slide. If you're familiar, as Yvette mentioned before, with our Heart Code, our blended learning courses, this course is just that. For those of you who are not familiar with our Heart Code courses, the learning methodology relies on an adaptive learning module. What does that mean? The online portion customize and adapt to the learner who is taking the course. Depending on your level of comfortability with the subject, you're given the opportunity to select your competency level. So if you go in and you say you're an expert, for example, the program will provide some questions at the beginning of the course. If the participant is able to answer them, the student moves on with the course. If instead you do not know the content, the course will give you the option to review the knowledge content before progressing with the actual program. This is a unique because the class is never the same for two different people. It may take longer for one person to go through the course content as opposed to another. The other nice thing about the program is that it's a modular. You can stop and come back and review it as many times as you want in the 2-year period of the course once you've activated the license. Of course, there is a hands-on portion. Once the student completes the online portion, they must come to an ASLS authorized ITC class and complete the in-person portion with an instructor. This part of the training is broken down into 3 different parts. This portion takes approximately an hour depending on the stroke scale selected. The student selects the stroke scale from our 14 scales to be evaluated on. The objective is to use the stroke scale that is being used in the student workplace with the objective to ensure that the stroke scale is being applied correctly. As we mentioned, the evaluations are broken down into 3 parts. Part A is a demonstration of the stroke scale, so the student will utilize the stroke scale to evaluate a normal patient. Part B has the student using the same stroke scale to evaluate and identify stroke syndrome. And Part C, the student will have a stroke patient with a complication of some sort and will need to manage that patient appropriately. While in the first 2 sessions, the students will evaluate a real patient, in this part, Part C, the student can interact with a mannequin or a real patient. Next slide. These are the 8 modules the student must complete before receiving the completion card of Part 1 of the training. I want to point out that there are 3 course options: ASLS pre-hospital course, ASLS in-hospital course, and the combined track, which include both pre-hospital and in-hospital content. Within the course, the student also has the opportunity to review how the stroke scales should be utilized when examining a patient. Next slide. Take it away.
Awesome. So we're going to go now and really go into a lot more detail about the different components of the e-learning program. And Marida will then take a little bit more time going into more detail on the skills evaluation piece. So the course uses a methodological approach to all of these components. The first piece that is woven throughout the course that's really important is to create a sense of urgency. As we know, neurons are dying every minute when they don't have blood flow. And so we, throughout the curriculum, really talk about time as brain, the urgency of evaluating and starting treatment as soon as possible for each patient. We also spend quite a bit of time making everyone comfortable with what a stroke looks like. What are the signs? What are the symptoms? What does it look like in a patient? And so there are several different ways that we do this, including lots of graphics and visuals that I'll go into. The next part is focused on stroke management. And this is, again, once the patient has been identified to potentially be having a stroke or is having a stroke, what are all the things that need to happen for them? And that, again, includes management of ischemic stroke and management of hemorrhagic strokes. And the last part is to make sure that everyone is familiar with their stroke systems of care and also what are the best practices around stroke systems of care. So I'll go into more detail on each of those. Next slide, please. So again, in order to create a sense of urgency, we reiterate over and over in the course, time is brain. We explain pathophysiologically, what is it that's happening in stroke that, basically we can reverse or help improve by treatment. And we also use patient stories, again, a lot of visuals around videos and photography to show what patients look like and talk about the huge impacts, both in disability as well as costs, et cetera, if people are not identified and treated in time. We also provide epidemiological background on the impact of stroke worldwide, and this gets updated over time, again, focusing on the disability and economic impacts. And the other piece is really to create this sense that we're all in healthcare in this together to help take care of our patients. So from the moment that the patient is identified, whether that's out in the field in their home, or in the hospital, all the way through, diagnosis, treatment, and discharge from the hospital and rehabilitation, that we're all one large team working together for this. Next slide. And then stroke identification. So we have learned over and over through the years that this is, one of the biggest pieces. The healthcare professionals need to be familiar with what types of stroke exist, and then what does it look like? What are patients complaining of? And then when I examine them, what are the signs and symptoms around that? So there's a lot of time focused on, again, showing what these look like, breaking it down into details, anatomically, as well as vascular anatomy, and then we simplify it. Ultimately, healthcare professionals need to know what to do with the patient in front of them. And of course, the brain is incredibly complex. And so what we've done is really taken that complexity and simplified it to make it make sense for the patients that we're seeing in front of us. So if I'm having a left hemispheric stroke, what are the common findings associated with that? Not meaning that every patient's going to have all of those findings, but that now our healthcare professionals can start to put these patterns together, and they know what to look for. And they're like, oh, this looks like it's a patient's having a stroke. And so that's really our big focus doing this. And so with that, there's an anatomy review. There's a pathophysiology of stroke and what's happening. The different types of strokes are described. And then we also go over stroke risk factors, the simplification of stroke syndromes, as I talked about, as well as what are some common stroke mimics, thinking about what else might be going on with the patient that's making them present this way, to make sure that we get the patient the right treatment. And then ultimately, we also go into pediatric stroke, which of course, all comers, it's not the most common kind of stroke, but it is really important for folks to be thinking about it that are taking care of kids, especially in that first year of life. Next slide. All right. So the other part of stroke identification, as Marida was talking about, is that we include the most commonly used stroke screening exams and stroke severity scales in the program. And so you see them listed here. These are generally pretty regional. And in the hospital, of course, the NIH stroke scale has to be performed, as that's the gold standard. But many other scales are being used to try to determine whether the patient is likely having a large vessel occlusion and requires a higher level of care. And so all of these different stroke screening exams and stroke severity scales are included in the program. And there's a video for each one that shows both the learner and also supports the instructors in how to do those exams correctly and how to score them correctly. Additionally, there's interactive video cases as the learner's going through the program for each stroke syndrome, that they then have to identify what are the abnormalities, and then putting it together. Is it most likely a stroke syndrome, a stroke mimic, and which stroke syndrome it is, based on the findings that they're seeing in the video. Next slide, please. Awesome. And then we go into stroke management. And as Marida nicely delineated in the modules, we start with initial management. So it's, broad to all healthcare professionals. And then we focus quite a bit on EMS and as well as on the hospital side. So for EMS, we really focus on an organized approach to the initial patient management, to those really important handoffs, as we know, and we've learned over and over the importance of handoffs in, taking care of patients and making sure that all the information that's needed for the next team to continue to care for that patient effectively has been given and received. So there's a big piece on how to appropriately give this information and what should be given. As well as for EMS, we have a whole module on interfacility transport to higher level of care. Increasingly, really throughout the world, there are these hub and spoke models where a patient might go to their nearest hospital initially, potentially start getting a thrombolytic, but requires endovascular care or additional higher level of care, and now has to be transported. And that's another challenge for our EMS providers to be able to take care of those, either critically ill or potentially ill patients that require higher level of care. So we go over all the details of what they need to do that effectively. And then, of course, management of potential complications, either from the stroke itself or from the treatment of stroke. Next slide. And then in hospital, we comprehensively go through everything from the emergency department or initial point of care, if the patient has their stroke in the hospital, all the way through discharge. And again, this goes into details on neuroimaging, which is increasingly being used to determine which patients are going to get which treatments. Obviously, we need to determine whether the patient is having a hemorrhagic or ischemic stroke, because those are two very different pathways for management. And then we go into thrombolytics, endovascular care, supportive and critical care, which is still very hugely important for these patients, including prevention of complications. The other part that should occur for all of these patients, which is covered, is an etiologic evaluation and secondary prevention, as well as the beginning stages of rehabilitation if they still have some disability or abnormalities after their treatment. Next slide. And then the stroke systems of care piece, again, this is very local / regional. So the content in the program is sort of broad, but also talks about best practices, with the goal that once the learners come in to your training centers, then you can talk about what are your local or regional protocols, order sets, processes for a stroke system of care. But we know it's really important, just like in trauma care, in MI care, and resuscitation, that there's a system of care that's determined, that is coordinated with EMS, or that patients know where to go, or we get them to the right level of care. Next slide. Awesome. And as Marida already touched upon, and you heard a little bit of in the video, one of the wonderful things about this model of being able to do all of this e-learning is that, one, you're going to see some of the rich graphics that really cement the learning. But the other piece is this individualized adaptive piece. And I know we've all been hearing about AI. We're obviously a simulation center here at the Gordon Center. And so we're always looking at how to effectively leverage technology for learning. And this is amazing. The American Heart Association first went to this model with the latest resuscitation heart code courses. And it really is assessing the learner as they go through and determining what they already know, so they don't have to spend time reviewing things they already know, and then focusing on the things that are gaps that they don't know that they need to know. And it does it in a very interactive way. And then, of course, as we talked about, it's modular and mobile. So you can do it in multiple different devices. If you start in one place, and you can do it elsewhere, which is really wonderful for a really busy, healthcare professionals and clinicians these days. We usually recommend the larger the screen, the better, because the graphics are so rich, but it works really well on a phone if they need to do it there. Next slide. Awesome. And now we're going to just show you a little bit of several different modules to try to elucidate the way that it works and to show the interactivity. If any of you have participated in e-learning, you know that, folks, sometimes it feels like a checkbox that they have to do, and they put it on the side of their screen and they start doing something else. What's great about this program and model is that there's really not an opportunity to do that, because the learners have to interact with the screen regularly. And as you saw there, it asked them, do you feel like you know this content? At the bottom left here, you can see that they're rating themselves. So here it says advanced beginner, and it can go all the way to expert. And so based on their self-rating, it'll either give them content first or questions first, but it'll adapt as they go through. So if they are getting everything right, it'll say something like, you rated yourself as an advanced beginner, but you clearly know more about this. We recommend, potentially increasing your, changing your rating, or it'll start giving you questions. And again, if you rate yourself as an expert, it'll start giving you the assessments first. But if you're missing them a lot, it's going to recommend that you review the content. And as you saw there, as they go through, they have to interact with the screen. There's also a coach, so the learners can choose to also audibly hear the content as they're looking at it and interacting with it, and then the rich graphics. Next slide. Again, looking here at pathophysiology and showing the interaction, as well as some of the content. Again, all of the latest, greatest content around stroke care is provided. And this is showing here the differences between, or all the details around ischemic stroke, what are the likely causes. The same thing is in the program for intracranial hemorrhage and subarachnoid hemorrhage. And again, you see the levels sort of interactivity in order to see all of the content. Awesome. Next slide. And the other thing that we really do in this program is, support these, what does it look like to have a right facial droop, right? Often people mistaken one side for the other because the side that is moving kind of looks a little abnormal, but really that's the normal side because it's moving. So again, supporting what these look like. And here's another example with dysarthria and aphasia. So we go through these videos that show what expressive aphasia looks like versus dysarthria, because learners often get these confused. And obviously it's important when you're trying to put together where in the brain the stroke might be, which one of these is going on.
Tricks you can teach and
Awesome. Next slide. And then the other piece, as I alluded to before, is because increasingly imaging is such an important part of determining what therapies patients are going to get. And we must do it in order to determine whether it's hemorrhagic or ischemic stroke. All of this is included in the program. So everything from aspect scores, perfusion scans, all of the, MRI, et cetera, what are the things that we're looking for, at a level that's appropriate for healthcare professionals in the hospital that are taking care of stroke patients. Wonderful. Next slide. Great. And then we wanted to show you a couple of the probes, so the questions that the learners have to answer when they go through the course. So there's different types of questions. There's sort of common multiple choice questions, some where they have to identify more than one. And then once they choose the answer, they also get to rate whether they think they know it or they don't know it at all. And that'll play into the decision making that the program makes around what to give them next. And then if they don't know it, what you're seeing here is it'll give them, if they get it wrong, it'll give them just the associated content with that question so that they can review it before they get another question, which will usually be a little bit later. So they can review the content and then later it'll come back and ask them another associated question to that learning objective that they need to get correct. And again, it uses a mastery learning model. So there's no comprehensive pre-test and post-test to the course. They have to get every single question associated with a learning objective in the course correct before being able to complete the course. And so what that means related to the individualized content is that someone that's proficient and does stroke care all of the time might take 2 to 3 hours to go through the course, and someone that's a complete novice to it might take 10 hours. So that's an important thing to also let your learners know. Next slide. Awesome. I'm going to pass it off to Marida to talk about the details of the in-person components.
Thanks, Yvette. So now that our students have gone through the online portion, we're going to discuss the in-person skills components. There are 3 components, as I mentioned earlier, part A, B, and C. And we'll just go into a little bit more into detail of how each one works. So part A covers the skills demonstration. Students are going through this to focus on what they're likely to use in their day-to-day practice or their local protocols. So if their EMS system uses the BFAST, for example, then they will practice and be evaluated on that stroke screening scale. In this session, a standardized patient who can be an actor or an instructor will portray a normal neurological exam. The student must perform all the components of the pre-chosen scale and conduct the neurological exam. This part is focused on allowing the students to get familiar with the pre-chosen scale. The instructor will provide any feedback on techniques and approach until the student performs all the components of their evaluation. It's important to know that the online portion does provide a video for each of the common stroke scales, allowing the student to view them while they're taking the online portion. These videos also help the instructor demonstrate the appropriate way to conduct the skills portion, and they can also be utilized to conduct any remediation if needed. These videos are also available separately for the instructors to use. So I want to show you an example here of what one of these videos look like. Can you show the video, please? We're not getting any sound. Anyway, we can go to the next slide.
Thank you.
This was just to,
If there's
here we
symmetry
go.
and no droop, the score is 0. Again, smile big for me. Okay. If one side is drooping or weak, the score is 1. Could you close your
Okay, we
eyes?
can go to the next
Or
slide
raise up your
now.
hands, palms up.
Marita, I think that your video might need to be turned on so that we can see you.
Okay, I thought I was being spotlighted. Sorry. Okay, can we go to the next slide, please? Thanks for that. So each of these videos go through how to do the components correctly, and then what it looks like if it's normal or abnormal, and how you would wait for each of these, and how these are associated with those types of symptoms. In the checklists, there are learner checklists for each of these stroke scale, as well as an instructor checklist. This is an example here for the FAST-ED where you'll see that there's an instructor checklist, and then they go through part A, which is normal, and everything will be 0 because everything will be normal. Then when we get into part B, we'll talk about that later, and we'll have some knowledge, and they have to basically go through each of these stroke screening scales so that they pass the first part A of the course. Next slide. Once the student has completed successfully part A, we get to the part B. This is a stroke syndrome evaluation. So once the student has completed successfully their stroke between the exam or the skill part, they know how to do it a second time. And now this is very important for the students to be able to identify a stroke syndrome based on the findings of the scale they're using. These are the common ones that are included in the program, and the student has to identify all the abnormalities, and they have to determine the score if there is one, and then put it together to identify a stroke syndrome. So when we do take them, we always have patients that we will have a standardized patient that will have a syndrome, and based on the skill on the checklist, they will have to identify what that syndrome is. So on the top right here, you can see part of the instructor checklist, what the instructor checklist looks like for part B. So that will help the instructor guide the student to identifying that stroke syndrome evaluation. Next. After that, we move to part C, and this is focused on stroke management. So we like to think of this somewhat similar to an ACLS course. For those of you that are familiar with the training, it's sort of equivalent to an Omega code. So it is a simulation scenario where you have a stroke patient, but that patient will have some kind of complication. That complication will need to be managed by the student based on the knowledge that he has learned on the online component. And those critical skills will be identified when they're managing this patient. One way that it's different from things like resuscitation is that there's a scenario that each one is different from the other. So there's 45 scenarios in the course and to choose from for testing as well as for practice. And we recommend that all of these have the options for the students. We recommend that all students practice, and especially if they're not familiar with stroke or not familiar with simulation. These scenarios were also developed in such a way that you can use either a standardized patient or an instructor, actor, or simulation mannequin that is given to the training centers, gives the training centers most flexibility possible. Obviously, if you have a simulation mannequin, that will free up your standardized actor to be able to do only A or B. And then they can do all the management pieces on the mannequin itself. Next. So now let's go to the instructor development. As you know, this follows most of how AHA does their training and instructor development or other trainings. So the instructor candidate first must go through the online portion, and that was what we've just described up until now between Yvette and I. And then the online portion, I just wanted to mention, I don't know if we said it before, besides the video and the interactive online course, the provider manual is also available within the online course. The instructor instead needs to go through a checklist, which we have listed here on this slide. They must select the track based on which courses the instructor candidate would like to teach. And so they can go through the three tracks depending on which instructor they would like to become. So we could have an instructor candidate can be a pre-hospital provider or in-hospital provider, or pre and post and in-hospital provider, and that's the combined. So depending on which of these provider courses they have taken, they have the eligibility criteria to become an instructor for that specific course. Once they have completed that course, they must go through the skills session for the online portion, get a provider card, and then they are eligible to become an instructor. Once they become an instructor, they must complete an instructor essentials online, have an instructor manual. Now, one thing about an instructor manual is that internationally we provide only digital instructor manuals, okay? So once they've completed the essentials online, they attend all the didactic courses of the instructor course, which is a one-day training. And then the instructors, candidates must be successfully monitored conducting the student evaluations, part A, B, and C as instructors candidates. After the in-person event, next slide, they will get their e-cards. So this is just what the e-cards look like. On the left here, there's the provider card, and on the right is with the instructor cards. They're the same as all of the e-cards AHA provides with the QR code. And the e-cards are also issued through an authorized ASLS and ITC. Next slide. So we just wanted to mention a few things about how a training center can become an ASLS center. Next slide. What the next steps are. So any requests, we have an email that you can write to, and if anybody wants to write this down, it's written here. Any requests for ASLS provider training, instructor training, adding the discipline to your ITC or new ASLS ITC, you must send an email to asls.international@heart.org. Once we receive your applications or your requests, we will direct them to the appropriate territory and regions currently now present globally, because we have launched a course and we have some regions, as you know, which already have ASLS International Authorized Training Centers to begin conducting those trainings. Next. So your training center must be in the process of becoming an ASLS training center before attending or aligning with an AHA training center. And this follows suit with all of our training centers. An instructor who becomes an ASLS instructor must be aligned to an ASLS training center, and for them to continue conducting the training and the courses and issue e-cards. Next. This is just an overview of the pricing that are available for purchase on Shop CPR currently. And we get more information on this through your international training center that is approved with the ASLS discipline. Next. This is just an overview of the ASLS international rollouts that we've done thus far. In 2023, we're really excited to know that we've gone into all of these countries: India, United Emirates, Jordan, Oman, Mexico, Kingdom of Saudi Arabia, Nepal, and Germany. And these countries it was a great experience working with all of the countries, and we've actually developed many training centers from this, and some instructors, such as about 100 instructors now we have globally, internationally. These are the two websites that you can go to and email as before. Next. Okay. Thank you.
Hello. There are a few questions in the Q&A that we will answer by the panel. We have Yvette, Marita, and additional staff at the AHA that will be answering questions. Quite a few questions did come in at the end, so if we don't answer your questions, we will answer your questions via email when we send out the presentation, PowerPoint slides, and the recording. Number one, will there be a printed ASLS instructor manual available? Marita, will you take that on?
Yes, as I mentioned before, the printed manual is not available internationally. So we do have those manuals in the US, but internationally we only provide digital versions.
Number two, I'm a BLS and ACLS instructor and interested in becoming an ASLS instructor. Kindly, what is the way towards this? Where/how to take the ASLS instructor course? Yvette, will you take this answer on?
Yes, I was trying to type an answer as well on a different question. So I think actually Marita's probably the best person to answer this, and probably regionally, some of your regional representatives from the AHA can most closely answer this. But there's already been training in your regions, which is why you've all been invited to participate in this informational webinar, so that the goal is to continue to expand that. So I don't know if Marita, you want to take that generally or have
Sure. So to answer this question, the best way is to go to your regional office. They can direct you to the appropriate training center that has the discipline added, and they can organize or will let you know if there's any ASLS training going on in the future for you to become an ASLS instructor. So for example, if you're in the Middle East, then you would go to the Dubai office team. In the KSA, you would go to the KSA team. And in India for now, you would go to the team in India, Dr. Sachin. And then the rest of the regions, you can write either to the email that we have provided, and then we can filter those requests, filtering them to the appropriate regions so that they can answer your questions and direct you appropriately.
Thank you, Marita. What is the cost of the instructor course? Marita, will you take that on?
Sure. So the cost of the instructor course will depend on the training center itself and the materials that you need to purchase to take the instructor training. We gave some pricings at one point. To become an instructor, you will have had to have completed the online portion of the provider training of whatever track you decide to become an instructor in. And so that means the purchase of the online portion. And then to become an instructor, you'll need an instructor manual, which needs to be also purchased, and any other materials that the training center will guide you and direct you to buy. Once you do that, you will have to go through the instructor training. So any of the pricing is up to the training center because it will depend on the resources, the venue, and that's something that the AHA doesn't get involved in. But it's up to the ITC itself.
Thank you, Marita. The next question is how/where to find a center to undergo ASLS instructor course. Marita, will you also take that question on?
Sure. So to find an ASLS course, the best way is to email the asls.international@heart.org email. And then we will filter those questions and guide you as to where instructor courses are being conducted within each of the regions through the regional office.
The next question, is there only heart code course available or is there any availability for another module? Marita?
So I'm not sure I understand what other module you're talking about. So the ASLS training is a blended learning. So there's the heart code and then there's an in-classroom session. Currently, well, this is the only way that this courses can be conducted. It can't be conducted separately or just online. I don't know if
I think can I take
Yeah.
one related question to that? There was also a question related to ACLS and ASLS heart code and what's different about them. So obviously the focus of the content is different. So ASLS is purely focused on stroke care, but related to the adaptive learning, there are a few differences in the way that the material is provided. The adaptive learning platform itself is the same, whether it's heart code for resuscitation or whether it's ASLS for stroke, but there's a lot of rich graphics and videos and things like that in ASLS to help support the learning. I hope that was kind of what the question was getting at there.
Our next question, is there any certification at the end of the course training? Marita?
So if we're talking about an e-card, yes. The e-card is issued at the end of the provider training and at the end of the instructor training, just like any other AHA course, if that's what you're referring to.
Yeah, and I answered that on in the Q&A as well. So they have to complete the e-learning. They get a completion certificate that then they bring to your training center when they're going to do the in-person skills evaluation. And then once they've successfully completed that, they get the e-card. So just like heart code, they have to finish the e-learning, do the in-person skills, and then they get issued their e-card, which is good for 2 years.
Thank you. A lot of these questions are similar. We are also getting questions based on languages. Marita?
What is there a specific one?
Is the course provided in different languages as well, such as
It will be. We are going forward and for translations. Right now, the version is just international version, English available. Soon a Spanish version will come out within the next few months. And then going forward, depending on where we're going to conduct the rollouts, we will decide which languages are going to be translated.
How many hours would be the skill station? And how many hours would be the CME hours, as we have to meet the educational hours of the AHA CSC certification? Marita or Yvette, will you take one of that question on?
Well, I can answer the questions on how long the course will take. So the skill sessions is approximately about an hour, depending on the skill, the stroke, the screening scale, or the scale used. As far as CMEs internationally, we don't provide CMEs in each of the regions because each region has a different process for issuing continuing education credits. Did you want to add anything to that, Yvette?
Nope, I don't think I have anything to add.
As an ITC with ASLS as a discipline, can we host an ASLS instructor course?
So to be able to host an ASLS course, you need to have the discipline added to the training center, because you won't be able to issue any cards or certification otherwise, or even the products for that matter. The products can be bought on Shop CPR, but to host the event, you will need to be an ASLS ITC approved. If
Yeah,
that
that's what it started with, Marita, just to clarify. It said they are an ASLS ITC. Can they host an instructor training?
I understood ACLS, that's why I was answering that.
Yeah.
If they are an ASLS ITC, yeah, they can host it. I thought it was an ACLS ITC that was asking if they could host an ASLS. That's what I understood. Sorry about
That's
that.
that's actually a great thing to clarify, though. I think, you know, if they wanted to sort of go on to the next steps, which you had reviewed.
Right.
There is a question about Marita. When will there be an available ASLS training in KSA again?
I would suggest writing to the regional office. We are organizing some training coming up. That way we can give you some more specific details on any dates for any upcoming training. There are training centers in the KSA who already have the disciplines and are conducting training. So that's the question. When am I coming? Is that when would the next time you're going to conduct instructor course here in KSA? Again, we're going to have to work with the regional office and see where it is that we're going to go next to do some instructor training, but it will be soon.
There's a couple of questions that I think we can maybe take together. There's one on, is there a plan to provide the ASLS provider manual internationally in the coming year? The provider manual is part of the e-learning course. So when the learner participates in the course, not only do they have access at the time of the course, but they have access for the entire 2 years of certification, where they can go back and review and also look at their provider manual. And again, that all gets updated with any content. One of the wonderful things about having a lot of these things digitally is that we can update them on a more regular basis. And so with the SAH guidelines coming out in the next couple of months, everything will get updated with the new content from the new SAH guidelines, and that will include the provider manual, the reference guide, all of which, and of course the instructor manual, all of which are available digitally. So we look out for those things. That will be great.
We have time for one more question. For an ASLS ITC to conduct an instructor course, does it need to have an ASLS TCF?
As in all instructor training, yes, you do need an instructor expert faculty to be able to train a new instructor. This course is being rolled out and it's pretty new. We're trying to get people, the training centers up with the instructors. Once those instructors get expertise in conducting this course, where we will begin developing some training center faculty so that you can conduct your own instructor training. For the moment, AHA staff and some regional volunteers and regional faculty we've begun doing that training. But as we grow and as we implement the course, we will be getting more expert instructors and begin doing that development as well.
Thank you, Marita. If we did not get to your questions, please send any questions to asls.international@heart.org and we will respond. We will also answer any additional questions that were not answered in this webinar via email. I want to thank the panel and all the speakers. Thank you for everyone who attended. The recording will be sent out tomorrow. As always, please feel free to send any additional questions to asls.international@heart.org. And thank you for your participation and have a great day.